I'm Dr. Richard Bernstein, an osteopathic physician and specialist in physical medicine and rehabilitation. About 6 years ago, I began incorporating the use of decompression therapy into my practice for the treatment of numerous types of lumbar spine disorders. As an osteopathic physician and specialist in physical medicine and rehabilitation, the primary modalities that I utilize for treating patients with lumbar spine disorders prior to beginning integration of the SpineMED therapy was osteopathic manual medicine, physical therapy, various types of injection therapies, and prescription medications. When necessary, I would also refer patients out to interventional pain specialists for epidural steroid injections, facet injections, nucleoplasty after first obtaining a discography, and when absolutely necessary, referring them out for a spine surgeon. Since integrating the use of SpineMED decompression therapy into my practice, what I've noticed is a significantly increased effectiveness of non-invasive treatments. In addition, I've noticed a dramatic decrease in my need for referring patients out for more invasive and expensive treatment protocols. After reviewing my records over the past year, I'd estimate that at least 70 to 80% of the patients that I've treated with the SpineMED decompression therapy have experienced approximately 70-80% improvement in their symptoms and a corresponding decrease in their level of disability. In addition, particularly patients with facet joint syndrome, I've noticed an incredible response to that, and many of them have reported 100% recovery from their symptoms. My patient assessment for determining if patients are suitable for treatment with the SpineMED decompression therapy have changed dramatically over the past year. What I found is I'm able to treat a much broader range of patients, including much more severe clinical symptomology as well as increased age. Patient results with the SpineMED decompression therapy have been very encouraging compared to previous models I've used in the past. Particularly, I found that patients are much more comfortable, and I'm able to treat a broad range of patients with the SpineMED therapy than I had with previous models, particularly due to design hardware issues that precluded many patients from being able to tolerate those treatments. I've been able to treat patients well into their 70s and 80s who've been suffering from severe chronic pain for many years with the SpineMED therapy and treated them effectively. In addition, I've had great results in treating very active athletes and patients with very demanding physical labor jobs and very physically demanding lifestyles. SpineMED has incorporated 3 unique design features into their decompression tables that I believe has dramatically improved the clinical efficiency of decompression technology. Their pelvic restraint system allows for effective isolation of the lumbar paraspinal muscles during treatment and is remarkably effective and comfortable for the patient as well. They also have a pelvic angle elevation feature that allows the practitioner to effectively target decompression at specific disc levels. They've also included an infrared heating system built directly into the table that allows the paraspinal muscles to relax during therapy. Adding SpineMED to my practice has allowed me to effectively treat a much larger number of my patients with back pain. I've also seen a dramatic increase in referrals from other physicians, healthcare providers, and satisfied patients as well.